Well, not too long ago we talked about corneal ulcers, and this is not really related to corneal ulcers. It's kind of related to another condition in the eye called, people get this, dry eye. Okay, so what we have is, this is my rendition. I'm no artist, but this is my rendition of the eyeball. And what you have here is the tear glands up above the eye. And what they do is they produce tears. And anybody who ever watched Old Yeller knows what tears are about. And they come down here, and what they do, they come down here, and they clean all the dust and all that material off the eye, and then they exit out here through the nasolacrimal duct, which actually, as it sounds like, empties into your nose. So I get a number of clients that come in every once in a while and say, you know, my dog has an eye infection. It's got an eye infection. I said, what do you mean it's got an eye infection? Is it uncomfortable, or what's going on there? So, you know, it tends to accumulate a lot of pus in the eye, and I see all this, you know, kind of purulent material in the corners of the eye, especially down here by the nasolacrimal duct, and the eyes just look kind of irritated. And so then we'll do what we call a Schirmer tear test, which means we measure the tears, measure the amount of tears that are being made by these tear glands up here, okay? And sometimes they come in, you know, they come in much less than 10, then we start to think about, well, this dog has dry eye, and all that's going on here is we don't have any more, in fact, maybe you can think of this like, in the old days they had cars that had windshield wipers, and they would have this little duct up there that would spray out stuff and clean your windshield off. And nowadays they shoot kind of in from the hood, but in the old days they came up from the top, and that's what this is. So what you're doing is put windshield washer fluid, and you're going to clean all that off. And if you quit making that, then you start to accumulate stuff on your windshield, and that's all that occurs here. Now, what we can do, we know that there's a third eyelid, and that's down here. And that makes about 20% of your tears. And these up here make about 80% of your tears, okay? So we know that we can stimulate those with certain kinds of drugs. Tacrolimus is the drug we happen to use at our place. And this will make those tear glands make more tears. And if you get more tears, you're getting more windshield washer stuff coming down over these eyes and cleaning all the pollen and all the, you know, that mucopurulent stuff out, and we can get those, lots of times we can get those tears up to like 15 or 16 or something like that using tacrolimus. But I think what you don't want to do is you don't want this to go for so long that you start to get permanent changes in the cornea. And I see that happening all the time. I wish that didn't happen. But you know, a lot of times you're going to go in the veterinarian's office. Is this something that's concerning you? Ask them about it. You can ask to have a Schirmer tear test, but they should kind of dream that up themselves when you describe what you have. And but we see this all the time, and we'll use the tacrolimus. Sometimes we use Tears Again gel. Sometimes we use Optics Care. There's a number of things you can use as an, you know, it's like two things to try to make more tears. And honestly, those dogs feel much better. And anybody who rides a motorcycle without a face shield knows what dried eyeballs feel like, and they don't feel very good, which is why they make goggles for people. That's just probably keep the insects out, but they don't want to drive all those tears off your eye and dry the lens out, or dry the cornea out, excuse me. So if you have dogs that have a lot of mucopurulent material, you may have something going on. Maybe you got conjunctivitis or something like that, but in many cases these are dry eyes. And I used to tell my clients, well, it's kind of like when it doesn't rain here in Battle Creek, Michigan, and then we get all the leaves and candy wrappers build up into the on the corner of the road, and what happens is there's nothing to wash those away. We're not getting rain. We haven't had any rain for 4 or 5 weeks. So when we get a good rain, it flushes all those things right down the drains, and that's kind of what's going on here. And somehow or another they understand it when I talk about candy wrappers and garbage on the street better than I do when I draw something out like this one. But nonetheless, it's a disease. It's fairly common. You know, certain breeds have it more than other breeds, but I think all breeds will get it if you're not careful. So go to your veterinarian's office, have he or she go ahead and do a complete eye exam, which usually involves measuring your pressures, staining the eye, and doing a Schirmer tear test. Schirmer tear tests are very helpful, and really when you get those drives under control, those dogs are much more comfortable and they're happier. So try to make your dog happy if you can. That's all I got to say about that.